Hello, I'm Charlie Kasko, Acting Chair of the Institute's Health and Healthcare Task Force. This group's mission is to improve the quality of life and standard of living for the residents of Northeastern Pennsylvania through the examination of health status, healthcare delivery, healthcare costs, and insurance. Social isolation became apparent and presented various disparities once the COVID-19 pandemic impacted different aspects of our society. Loneliness and isolation occur from many factors, such as illness of a family member or loved ones, separation from friends or family, loss of mobility, vision and hearing problems, language barriers, and lack of transportation. Additional risks of social isolation include living alone or acting as a caregiver, feeling the lack of purpose or meaningful engagement in activities, major loss such as the death of a spouse or a partner, financial stress, and major life changes like retirement. Even families adhering to stay-at-home protocols faced confinement-related stress, which includes overcrowding and changes in routine. In such cases, isolation is not limited to people living alone. It pertains to anyone facing interruptions in healthy social activities and normal supports. Nearly every segment of the population has been impacted by some sort of anxiety and depression, and we saw a significant jump during the COVID-19, as indicated by the U.S. Census Bureau's Household Pulse Survey. There are several programs or policies that may help individuals both nationwide and in the state of Pennsylvania who may be suffering from the effects of social isolation caused or exacerbated by COVID-19. We need to bring awareness of existing resources, activities, and networking options to engage and connect with others. Let's start with equipping healthcare providers with the tools to address the effects of isolation. Healthcare providers can be critical contact points for those experiencing negative effects from social isolation. Healthcare providers should receive training in identifying patients with isolation risk factors through surveys and screening tools. We need to explore intergenerational programs that match older adults with children or teens. This would address isolation in two critical cohorts. Technology should also be seen as a tool rather than an obstacle to creating intergenerational connections. Let's adapt strategies to prevent child abuse and domestic violence in light of social isolation. This is an important time for reinforcing to mandated child abuse reporters the important role of their responsibility. We need broader messages to the public on child abuse and domestic violence prevention and crisis resources. Public education surrounding the dynamics of abuse will prove valuable as well. Isolation is a common tactic of abuse, used to limit victim contact with family, friends, and other systems of support. If community members are aware of isolation as a means of power and control, they will be better prepared to recognize signs of abuse and offer a safe outreach. We can present opportunities to better access to public transportation and expand ways to travel safely, especially advancing options in rural areas. Although there are still businesses and organizations that are operating remotely, as in-person services resume, many individuals will face a different barrier to socialization: lack of transportation. Even before the pandemic, there was a significant gap in availability of public transportation. Social service organizations, community groups, and healthcare providers should consider maintaining virtual communication options used during the pandemic so that individuals with transportation barriers do not lose access to socialization opportunities as in-person events return. We need to identify the gaps in research pertaining to social isolation and continue the efforts to discover how the COVID-19 pandemic impacts different segments of the population in the long term. And finally, we need to educate the community at large on the health and wellness impacts of social isolation. Many individuals are aware of the seriousness of social isolation as a health concern. Thank you for your time.